morning everyone. So I've decided to do my presentation today on glaucoma or glaucoma, however you want to pronounce it. Sorry I can't be there, my IT skills aren't amazing either, so I'm going to try and hold this as still as I can and read my notes on my other laptop. So I decided to do it on this because I had a patient in clinic who was asking a lot of questions, so I just wanted to refresh my knowledge a little bit. I know a lot of people will already know a lot of this anyway, but hopefully it might be useful to anyone that's new possibly. So what is glaucoma? It's the name of a group of eye diseases that damage the optic nerve. The optic nerve transfers visual information from the eye to the brain, and if it's damaged it can result in sight loss and even blindness. There are three main types of glaucoma, so there's primary, secondary and developmental, which is in babies and children. It's a complicated disease and diagnosis is not always easy. There are several different tests that will be needed to confirm how and why damage to the optic nerve has occurred. In many cases, glaucoma is associated with high pressure within the eye. And to understand how glaucoma affects us, it's useful to understand the structure of the eye and why keeping eye pressure within the normal range is so important. So this is a bit of a diagram of the pressure in the eye. The pressure in the eye is determined by the balance between the production of aqueous inside the eye and its drainage out of the eye. Aqueous is made in a ring of tissue that sits behind the iris called the ciliary body. It then flows through the pupil and drains away through tiny channels called the trabecular meshwork. The trabecular meshwork is found in the angle between the cornea and the iris, often called the drainage angle. In a normal eye, there is a healthy balance between the production and the drainage of fluid. The pressure may vary slightly at different times of the day, but it normally stays within a range that the eye can handle. In some cases, this balance is disturbed and the pressure rises above normal. The pressure rise is usually due to the flow of fluid out of the eye being restricted. A certain level of pressure is needed for the eye to keep its shape, but if it gets too high, it can cause stress to the optic nerve, leading to damage. Damage caused in this way is diagnosed as glaucoma. So this is just another diagram just showing a normal eye, so the drainage canal allows fluid to flow out. However, in glaucoma, the drainage canal can be blocked and then the fluid builds up and the pressure of that fluid damages the optic nerves. So glaucoma types, there's primary angle glaucoma, POAG, also known as chronic open angle glaucoma or just open angle glaucoma, is the most common form of glaucoma in the UK. It is estimated that about 2% of people aged 40 plus have POAG, and this rises to almost 10% in people over than 75. It's a slow developing disease that causes damage to the optic nerve and is often symptomless, especially in the early stages. In secondary glaucoma, these issues arise due to a problem with the drainage system, so fluid outflow doesn't work as well as it should. The eye can get rid of the fluid fast enough and the build-up results in increased eye pressure. The increase in pressure damages the optic nerve by reducing the amount of blood that can get through the tiny blood vessels and by pressing on the nerve itself. In developmental glaucoma, about 5 in 100,000 children are born with it or develop it in childhood. The term infantile glaucoma is sometimes used for the diagnosis before the age of 3. In most cases, it is discovered before the child's first birthday. So again, this just goes into some other types that I found. So inflammatory glaucoma is a type of secondary glaucoma that can be difficult to manage, and that's because the inflammation can either increase or lower the intraocular pressure. The inflammation also causes white cells to form in the aqueous humour that can block the trabecular meshwork. Neovascular glaucoma is a potentially blinding secondary glaucoma characterised by the development of neovascularization of the iris, elevated intraocular pressure, and in many instances poor visual prognosis. And then traumatic glaucoma is any glaucoma caused by an injury to the eye. This type can occur both immediately after an eye injury to the eye or years later. and it can be caused by injuries that bruise the eye, from blunt trauma, and injuries that also penetrate the eye. So what are the risk factors? So the first one is age. So your likelihood of developing glaucoma increases with age, substantially rising over the age of 80 to more than 1 in 20. Blood pressure. Very high blood pressure can lead to an increase in intraocular pressure. Low blood pressure can lead to insufficient blood supply to the optic nerve. Ethnicity. People of African Caribbean origin have about a 4 times higher risk of primary open-angle glaucoma compared to those of European origin. People of East Asian origin are at a higher risk of developing primary angle closure glaucoma. So your family history, there is at least a 4 times higher risk of developing it if you have a close blood relative who has it. Short-sightedness, so people with short sight are at increased risk of developing it, and also people with long sight are at an increased risk of developing primary angle closure glaucoma. And also diabetes, as we know, so people with diabetes may be at a higher risk of developing it. So the link between diabetes and glaucoma. Research confirms a link between the two, and though the risk for glaucoma in everyone increases with age, if you do have diabetes, you're at a higher risk of developing the condition. So a study in Australia of more than 3,500 older people found a significant association between diabetes and glaucoma, while another study of almost 5,000 older people in the US found that open-angle glaucoma is more common in people with older onset diabetes. A separate study of more than 4,000 older people in the Netherlands, which looked for signs of diabetes and glaucoma, found that newly diagnosed diabetes and high levels of blood glucose are linked to glaucoma. These studies looked at one type which was primary open-angle glaucoma, which is more common if you have type 2 diabetes. There is also neovascular glaucoma, which we talked about earlier, which is related to the abnormal blood vessel growth in the eye, which blocks the natural drainage of the eye. This can affect people with type 1 and type 2 diabetes equally, according to a Danish study. Sorry, my camera was just going a bit off there. So what are the symptoms? So in the early stages, glaucoma might not present any symptoms at all. Most commonly, it affects your off-centre or peripheral vision at first, and this can go unnoticed initially, obviously because your central vision remains well. But some of the other symptoms are blurred vision, seeing rainbow-coloured circles around bright lights, intense eye pain, nausea and vomiting, red eyes, headaches, tenderness around the eyes, and seeing rings around lights, and usually both eyes are affected. So the treatment options, eye drops are the main treatment for glaucoma, and then you have laser treatment, which may be recommended if the eye drops don't improve your symptoms. This is where a high energy beam of light is carefully aimed at part of your eye to stop fluid building up inside it. And then surgery may be recommended in rare cases where treatment with eye drops or laser haven't been effective. The most common type of surgery for glaucoma is called trabeculectomy. It involves removing part of the eye drainage tubes to allow fluid to drain more easily, and the surgery may be carried out under local anaesthetic or general. Most people won't need to take eye drops anymore after the surgery, and it shouldn't cause a lot of pain after the procedure. And that's the end. Thank you.